Hi everyone, this is Dr. Mary-Zitta, and I just want to wish you all a Happy New Year. And I do hope that you are going to follow us on this YouTube channel for health advices that we can give, and not only health advices but also talk about some social problems that we are experiencing in our world today. It is important that not only do we focus on keeping ourselves healthy, but also our environment. So please visit us from time to time. Subscribe. What did I say? Subscribe. So that when we come on, you have first-hand information. Okay, hello everyone. So we're talking about diabetes right now. What is diabetes? Diabetes is a syndrome with metabolic disorder. So this disorder is either an inappropriate secretion of insulin, or there is an appropriate secretion of insulin but resistance to the insulin. Now, what is insulin? Insulin is a hormone. What insulin does is it carries the sugar from the bloodstream into the cells. And when it gets into the cells, the sugar is now used to produce energy. And we all know how critical energy is for the human body, right? We cannot function without energy. So what the cells do is they need to receive sugar imported into the cell, and then the cell now uses that to create energy. So you see that if that transportation is not accurate, there is a mismatch of the level of blood sugar in the bloodstream versus what the cells are getting to create energy. So what we do here now is people with diabetes either do not produce enough insulin to make that transport easier for us, or to make that transport of sugar into the cells, or they are producing enough of the transport of that vehicle, right? They're producing enough of it, but the cells are not responding to the insulin. So that becomes a problem, because then too much blood is in the bloodstream. And the cells are weak because they are not getting enough of their tools to create energy. So that is diabetes. It could either be that you are not creating enough insulin, or that you are creating enough insulin, but the cells are resistant to insulin. So now let's talk about the two kinds of diabetes. Today we'll focus on just type 1. What is type 1 diabetes? It has a few names. It could also be called juvenile diabetes, because you mostly see this, often in children and adolescents. So in terms of seeing this in children, you maybe between the ages of 4 and 7, and then in adolescents you see it between the ages of 10 and 14. So as we go down the list of things we're going to cover today, you will see that the reason why we call this juvenile diabetes or insulin dependent diabetes. What is the name? Insulin dependent means we depend on insulin. Let's take it backward. Why do we depend on insulin in type 1 diabetes? This is because in type 1 diabetes, there is a lack of production of insulin. Remember, we said in our definition that diabetes could either be limited production of insulin or appropriate production of insulin but resistance to insulin. So in type 1, there is inappropriate production or secretion of insulin by the pancreas, specifically by a certain cell within the pancreas called the beta cells. So why are these cells not producing enough insulin? They're not producing enough insulin because the body attacks itself and destroys the pancreas it destroys the cells within the pancreas. And these cells that are responsible specifically to produce insulin are incapable of producing insulin. So it's an autoimmune disorder at this point, where the body is attacking itself, and as a result, the manufacturing of insulin is very limited. It's lacking. So when do we see this? How do these children or adolescents present? Let's talk about the clinical presentation of these adolescents, all right? So let's talk about the presentations. One of the presentations, before we get to the presentations, let's talk about the risk factors of diabetes type 1. So the first thing that we know of as risk factors for diabetes type 1 is genetics, family history of diabetes, right? If mom or dad have a history, or grandmom, grandpa has a history of diabetes, then that increases the chance of the child, of the newborn child, or the young people to have diabetes later on in life, if not that young, right? Genetically, autoimmune, that's not something that we can help much. There was an error in the genetic makeup, and so your cells are seeing the beta cells that are the insulin producing cells as a foreign entity, and as a result, the only plan is to attack it, because they don't recognize it. This needs to be dealt with. So that's how our cells destroy our own cells and inhibit us from producing enough insulin. So we talked about genetics and family history, but very importantly, we don't talk about this much, all right, or we don't talk about this enough. But viruses can also predispose a child to diabetes type 1. Now, an example of these viruses include the enterovirus, specifically the Kawasaki B virus, right? In short, it's called CVB. So these viruses, which are more prominent in children, predisposes them to diabetes type 1, all right? Another virus are retrovirus, like the normal flu virus, right? They can also predispose a child or young person to type 1 diabetes. Another kind of virus is a mumps virus. But we protect the children naturally, not naturally, but with vaccine. The MMR vaccine, mumps and measles. So you see how moms, when you have the vaccine for moms, it helps you to be able to build ammunition to counter a mumps virus, which then limits your probability of having type 1 diabetes, right? So these viruses or viral infections to these different viruses predisposes you to diabetes type 1. Another kind of virus also is a cytomegalovirus. In short, CMV. So when you're predisposed to this as well, then you have a chance of developing diabetes type 1. So now let's talk about the clinical presentations. The clinical presentations of diabetes type 1. When you notice that your child has increased thirst, they're always wanting to drink water, drink something, all right? You pay attention to that. When you notice that they are using the toilet a little bit more often than usual, they're constantly urinating, so increase in urination frequency, you take note of that, because when you drink a lot, you urinate a lot, right? So observe that. But that's not all. Also look at if a child who has outgrown wetting the bed starts to wet the bed after they had mastered not urinating or not wetting their beds, then they start to do that. That should also be a red flag. But then again, that's not all, right? Now, remember I told you in the definition that the sugar in the system needs to be transported into the cell for the cells to create energy. So if there is no insulin that's transporting the sugar and for the sugar to create energy, the child would not have energy. So now you see weakness, you see fatigue, easy fatigue. So the child will play for a little bit and gets tired. And that's not normal for that child, because it takes months to years for the symptoms to be apparent. So you would know your child before the child starts to demonstrate symptoms, starts to display symptoms. So when you notice that, no, but this child used to play and was very energetic, why is the energy level down? So all of these things, when you observe these things in your child, then it's important that you take the child to the doctor and have their sugar checked. Now, when they have their sugar checked, how are they going to know that this child is highly suspicious for diabetes type 1? Now, before meals, the sugar level should be between 80 and 130 mLDL. It should be between 80 and 130, 130. That should be your fasting glucose, blood sugar. Now, after a meal, it should not be more than 180 mgdl. All right? It shouldn't be more than that. So when the blood sugar is higher before meals, if it's higher than 130, then that's a red flag. Of course, then we are confirming diagnosis, right, for diabetes. Now, whether it's a child or it's an adult, the measurements are the same. All right, they're roughly the same. Now, if you take the blood sugar after a meal and it exceeds 180, again, whether it's for a child or an adult, then there is high suspicion of diabetes. Now, what will really define diabetes and conclude it, right, or confirm it, will be the A1C levels. All right, but before we get into that, we'll talk about that later on down the line. But I just want to let you know that when you observe these clinical presentations in a child with diabetes, then it should raise concerns, and you should be able to take the child to the hospital and let's get this sorted. Okay, what are the treatments for type 1 diabetes? Okay, the pancreatic organ is not producing insulin because the beta cells are destroyed. How do we get insulin in the blood to transport sugar from the blood into the cells? So we inject the child with insulin, right? We give insulin to the child so that whatever it is the child is eating is not lingering in the system, right? It's not lingering in the system. So we inject the child with insulin. Some insulin injections are good for 1 day, 24 hours. Others every 8 hours. Others every 4 hours, depending on on your preference as well. Okay. Another thing that you want to take note of as well is in terms of management, you want to count. You want to really be able to count the number of carbohydrates that a child consumes. Because what is carbohydrate? Carbohydrate breaks down into sugar. And if there is limited insulin that is transporting that sugar, you want to make sure that you are not consuming a lot of carbs, right? So dietary modification is critical. Injection of insulin is also, and you can do this incongruent with each other, because that's when you find a balance, right? So another thing that we want to do in terms of treatment also is physical exercise. It's physical exercise. And we'll see that more in type 2 diabetes, where it's a first line treatment for diabetes type 2, exercise, so that you don't put much weight, and because weight is pumped up more by sugar. So if we limit the number of sugar in the bloodstream, then we are able to keep the weight down, less sugar, less weight, and we're better able to manage the diabetes for either the child or the adult. Now, what are complications? This is very interesting. It's important that you understand the complications so that you understand the significance of what I'm saying. What are complications of diabetes? Diabetes can affect all the organs in the body, in the human body. It can affect the brain, the heart, the lungs, the nerves, everything, even your skin. Let's go systematically. All right? Diabetes, because if there's too much sugar in your bloodstream, where do you need the sugar to go? Sugar is going to start sticking on the lining of the organ systems. It's going to go and clot the arteries, the blood vessels, the nerves, right? So when it clots the blood vessels, you see that it begins to affect the heart, because then the heart is, the vessels are not able to transport blood as easily as they could have without obstructions, without something that is constricting the blood vessels, right? It's limiting, it's making it more narrow. And then not enough blood is going into the heart, and that causes a whole set of problems. So blood vessels and heart, when it clumps on them, we have a problem with that because there's no normal circulation. But the body needs the demand. So the supply is not, it does not match with the demand. That is a problem. So now, when we talk about the nerves, too much sugar goes and clots the nerves. That's why sometimes you lose the sensation on the legs. And sometimes what the doctor will do is they'll take a pin. It's not painful, but they'll take it and they'll poke different spots or areas of the sole of your foot to see if you can feel it. If you cannot feel it, it means there's a neuropathy. It's called neuropathy. And the reason why there's a neuropathy, because the nerves are not responding to the sharp sensation because they are clotted. All right. So say, for instance, let me take this pen, for instance. Say you take caramel or candle wax that is melted. All right. Candle wax that is melted. Oh, no. Let's stick with sugar. So you take sugar and you melt it, and then you stick the pen into it, and then the sugar gets stuck right here, right? It gets stuck and it clouds this. When you try to poke through the actual pen itself, do you think it's going to go through? No. Because when the caramel gets hardened against the pen, you can hardly get access to the pen. So that's how it is. So within our tissues, our muscles rather, within our muscles, the sugar clots against it clots against, the nerve endings. And then the nerve endings are not able to transmit or to communicate that sensation of poking. So that's how a neuropathy results as a result of diabetes, be it a diabetes type 1 or diabetes type 2. All right. Another thing is the kidneys. There's a lot of blood vessels around there too. So you see how it constricts the blood vessels and limits blood flow. The eyes. A lot of people have cataracts, So these are the things that, so you see that diabetes complications are universal. It affects even the skin, hyperpigmentation. Have you noticed, if you have diabetes, when you look at the folded parts of your skin, say like your neck, your armpit area, they become extremely dark. Where you have a skin fold, all right, it becomes dark. That is as a result of diabetes, okay? So diabetes is a very, very, very important topic. So now let's get to a part that us women must pay attention to. Diabetes and complications in pregnancy. Because during pregnancy, you gain weight naturally, and there's a lot of physiological changes. Hormones are secreted left and right. Things are, over the roof. Everything is over the roof. So is insulin. In in a non-diabetic patient prior to pregnancy. Insulin production is also over the roof. So now, what happens? The mother becomes diabetic. And that sugar, that blood level, the sugar in the blood needs to be controlled. If it is not controlled, we will have a problem. All right? If it's not controlled, we are going to have a problem. You will notice that there is going to be an increased chance of miscarriage with diabetes during pregnancy. There is an increased risk of birth defects with diabetes in pregnancy. There is an increased risk of stillbirth in diabetes during pregnancy. So all these things. And when you have diabetes during pregnancy as well, the baby grows because the baby is dependent on what the mother produces. So when the mother has produced a lot of insulin because of a lot of sugar, the baby is born with diabetes as well. That's why family history. We talked about this at the beginning of the video. Family history, right? So maybe mom had diabetes prior to getting pregnant. And then during pregnancy, everything spikes even higher. So mom wants to make sure that the sugar level is being controlled for her sake and the sake of the baby. So this is how critical the topic of diabetes is. There's no exception. Every one of us, it doesn't, raise not so much, right? But usually people of color, like myself, are very prone to diabetes because we have a really poor eating habit, right? That and hypertension, but that's the story for another day. So you see that it's important that we take care of ourselves during pregnancy and prior to pregnancy or after pregnancy, because everything we do, our body responds to that. So today was just diabetes type 1. Stay tuned. Thank you very much for watching and remain blessed. Bye-bye.